Hi everyone. So today in this video, we will try to handle a very important topic. With me, I have the leading anatomy educator, Dr. Sandeep Madaan, the man who knows what is asked in the exam, how to tackle it. But I have a very pertinent, discussion today that when we talk about an exam called as INI-CET, in INICET paper, it is like you will listen people, every influencer, everybody talking on the YouTube that first, second year are very important in INICET exam. Especially when you are targeting institute like AIMS or you want to do your post-graduation PGI in MHANS, you need to be good at your first, second year subjects. In that first, second year subjects, especially in the first year subjects, anatomy has a lot of value. So, Dr. Sandeep, I wanted to know from you directly what are the things that are important in anatomy. If I was a medical student appearing for the upcoming May exam, what should I do? How should I get the strike rate? How should I get into the main exams using anatomy as a tool?
Good morning, sir, and hello, everyone. This is Dr. Sandeep Madaan, and as sir, you are saying that in INI-CET exam, particularly for the central exam, the first year and the second year subjects are of utmost importance. And yes, of course, I will say anatomy holds a special place. And when you look at it, like when we dissect the exam along with the dissection of the body, when we dissect the exam, we come to know that it is a concept-based anatomy and the integrated anatomy that is basically more asked in the central exams. And like more weight is also given to the embryology as well as to the histology, which is not exactly seen in case of NEET exam. And it is always the concept based anatomy, and I will say now the time has come for the integrated clinical anatomy. And particularly for the INI exam, what we have observed now, there is a change in the pattern, and they are asking even for the clinical exam, like for the clinical questions, they will be asking questions based on the cadaveric images. So students may know the answer, student may know the topics as well, but when it comes to identification of the structures, then it becomes a little bit difficult for them. So if someone wants to go for high strike rate, I will suggest that they should have good core understanding of the subject. They should have good conceptual basics clear in like anatomy and all the first year, second year subjects. Then they can score very high, and they should know the identification as well, because not only knowing the topics may not help. And the previous year questions along with that, they should more focus on the previous year topics, because sometimes
Yes.
language can be tricky, the
So,
questions.
Dr. Sandeep, if I summarize what I've learned from you is that integrated approach. Like, for example, we saw previous years a question on aberrant right subclavian artery and
Yes.
with patient on dysphagia. So, they try to do that integrated approach. Second is the beautiful point that you pointed out is cadaveric dissection images. And, sometimes they're going to the things that you may ignore as an undergraduate histology, embryology. And I think embryology is something which only INICET people are asking more and more as compared to other exams. They're pushing on embryology also. So I think that is very good observation. And also, Dr. Sandeep, because you have been teaching for I think more than a decade now. So, Dr. Sandeep, I would now pick on your brain to predict also. Now, if somebody is listening to us right now, and upper limb, suppose I talk about upper limb, what cadaveric dissection images do you expect? I'm putting you on a corner, but I want to use your decade long experience to get the prediction.
So I'll suggest, if you ask me the questions from the upper limb only, then I'll suggest brachial plexus in one very important chunk. And not knowing from the university point of view, like from the university point of view, students might remember, like they can mug up the branches names and all, but now we have to identify also in cadaver how do they look like. And also because in the exam they will be giving some images, they will be putting some markers, and then they will be creating a question on that, so we should be able to identify those. Along with that, I'll also bet on the nerves, like all the nerves like radial nerve, median nerve, ulnar nerve, they are being asked in a clinical setting, like if there's injury at this level or that level, what how the patient will present, what will be the further consequences and all. So those are the two major areas. Along with that, we will say some important areas where the clinical integrated integration can be done. For example, like we can say anatomical snuff box, carpal tunnel, cubital fossa. Those were the major areas which I will stress upon as a student.
Perfect, Sandeep. I think you have made things very easy for the students. Now, let me pick your brain on lower limb. Like, suppose lower limb, what should I do? What cadaveric images can I expect?
For the lower limb, again, I'll say the lumbar plexus, we should be knowing it. And along with that femoral triangle, that identification of the structures, like how the structures are arranged in that part, popliteal fossa, and the clinical questions can be asked on the veins. The superficial veins are there as well as the lymphatic drainage. Those are the major areas. And of course, along with that, one favorite area, that is Tendenberg sign. That
Yes.
is mostly asked in the exam.
Yes. So many times I see in the limbs, in particular upper and lower limb, they try to do that orthopedics integration.
Yes.
And when it comes to neuroanatomy now, they try to do that radiology and or neurology and neuroradiology and anatomy integration. So what
Yes.
about neuroanat? What do you expect?
Sir, of course, neuroradiology, you are the best. There is no doubt about that. So far as anatomy is concerned, I'll say the section, particularly where we have the basal nuclei, that
Yes,
section,
I
like,
totally agree. Totally agree.
yeah, that is like number of time it has been asked, because whenever I teach that topic in the classes, also I say question may not be directly asked from the basal nuclei, but this section is very very important. Along
Yes.
with that, where we have the third ventricle, like serratus section, that is also very important. And the students must be knowing how to identify how the insula is present, thalamus, like we have the basal nuclei, internal capsule, those areas, and how the like fornix 3D orientation should be clear. There's a difference between some students, they may know the names, like what something is called as fornix. Then there will be good students who are going to crack the INI exam. They will be knowing how the 3D orientation for the fornix is there. That is, I think there will be some differences there.
And Dr. Sandeep, thorax and abdomen?
So for thorax and abdomen, I'll say the walls are important. Like a Jaeger's vein, they keep on asking questions. But particularly for the heart, like I'll say, for so far as anatomy is concerned, students must be knowing about the coronary supply in a 3D. So when I'll be teaching, I'll be explaining them the surfaces grooves. In those grooves only, we have the coronaries running, and this is how they can learn properly, because the heart is not very straightforward structure. It's kind of having different orientation. And along with that, embryology, again sir, as you said, embryology for INA is a must. And CVS embryology, those areas where we have the aberrant arteries, recurrent laryngeal nerve, left side, right side, persistent ductus arteriosus, all those areas are of very utmost importance. And
And
abdomen, I'll say inguinal region, yes, very important. Inguinal
final
region,
region.
rectus sheath, and the blood vessels of the GIT. Those are the areas which we should.
Perfect. I think in a nutshell, Dr. Sandeep, you have already guided us what to do. But
Hmm.
I assume, even when you tell the students, many students would still be asking that, can you do it for us? So, Dr. Sandeep, can you do it for us? Can you,
Uh,
take a live session on this particular topic and make it the game changer for the INICET people? I want that people attending that session should have more number of questions correct than people who are not attending it. Can you make it happen?
I can assure, sir, I am coming live on the DAMS channel, and on the 9th of April at 12. And I'll be taking one complete session on whole of the anatomy, different chapters, as I told. And I'll be discussing the cadaveric images anatomy. And I can assure whoever is attending, because this is not a recording that I'll be giving something in recording and you will be looking at it. It is a live two-way interactive session where you will be knowing how I am identifying what is the approach and why I am saying this is particular structures. As if at all you are having any doubt, that will be settled then and there, and you will have a crisp and clear knowledge about those areas. So that is my, you can say, promise that if you attend that lecture, you will be having way more confidence in those cadaveric images, which right now you are thinking it might be difficult for you.
And let me just tell to the listeners that on 9th of April on the DAMS eMedicoz app, if you are a Back to Basics, TND, Ultimate Live or a face-to-face subscriber, you will get a special session on anatomy, cadaveric dissection-based learning by Dr. Sandeep Madaan starting at 12 noon. Let me just so I hope to see you there. I hope that this session makes a difference. But our goal today was to somehow summarize what is required. So if I ask Dr. Sandeep to summarize integrated questions,
Yes, sir.
Yes. Okay. Cadaveric dissection-based questions,
Definitely.
biology, histology. So
Yes.
can you now go deeper into it? Like how many questions can we expect out of anatomy in a standard INICET paper?
Basically, it will be asked in two different manner. One, like one set of questions will be directly from anatomy, but then there will be certain questions which are integrated. Like we have integration with the ENT, we have integration with the orthopedics, even with the radiology, as you said, or gynec. So total number of questions may vary with that respect. But yes, there are a good chunk of questions, particularly in INI. Basic subjects have very good number of questions.
Yes. And also, Dr. Sandeep, I would request that when you are doing the PYQKaBaap session
Yes,
for
sir.
anatomy, in this month, can you tell the date? When are you coming live with the anatomy previous year questions? I want you to predict based on those questions what will be asked in future. Can you tell when are you
Yes,
coming live?
sir. Definitely based on the previous pattern, as we were doing previously, like based on the previous pattern, we can predict like this. These are the areas from where most likely questions can be asked. So PYQ ka BAP session, I'll be coming 15th on our app, and definitely along with I will suggest like cadaveric images session and PYQ ka BAP. That will give one wholesome, you can say, anatomy treat. The one who is interested will be finding it of value.
And definitely, I think, Dr. Sandeep, you will also be coming on the INI-CET Predictor series on YouTube
Yes, sir.
with a
Yes, sir.
test on the eMedicoz app followed by a discussion. So I
Yes, sir.
think, with your experience, I think with these three put together, you
Yes.
are going to make a big difference in this INICET paper. So anybody who misses it, will not be happy later on. So please be there live on 9th of April when Dr. Sandeep Madaan starts with his dissection-based teaching. This is a unique pattern followed only in the central exams. So please be there. So any final words of advice from your side, Dr. Sandeep?
Yeah, I will say stay focused, work hard, and always do the concept-based study. Don't waste time on the uncommon areas. Do the common questions first, and all the very best.
So best of luck, everyone. We look forward to meeting you on the very important, first of its kind live session on the Damn Medicals app, dissection-based learning by a person with huge amount of experience in anatomy and in clinical knowledge. Dr. Sandeep Madan is going to be there trying to predict the questions for you. So be there. So wish you all the best. We look forward to meeting you on the app 12 noon 9th April. Wish you best of luck.
I'm eagerly waiting. All the best.
Bye, Sandeep. Thank you.
Thank you, sir.